understanding of population health evolves, so too does our appreciation for the social determinants of health. 80% of a person's health is affected by the status of their employment, income, and housing. Yet, we mostly use information collected in healthcare settings which only accounts for 20% of health status. That means we work with incomplete and potentially misleading data to make important decisions, such as health resource allocation, intervention strategies, and care coordination. Including social determinants can enhance the value of population data, and it doesn't need to be complicated. The United States has the most expensive healthcare per capita in the world, but only mediocre outcomes across the entire population to show for it. Gaps can't be filled with medical treatment alone. Inequalities in access and treatment are significant, and understanding these inequalities is crucial to providing high-quality care to underserved populations. Even all the money in the world can't produce health, as access to treatment is not the only or even the biggest barrier to health care that some Americans face, according to Don Berwick, President Emeritus of the Institute for Healthcare Improvement. Imagine if social determinants of health data were available in conjunction with information from healthcare settings, we could do much more for patients. We could measure the impact of intervention strategies, taking social determinants into account. We could anticipate patterns in health utilization and disease burden based on social determinants and proactively address them. And we could target the appropriate populations with the right outreach programs. Coded patient-level data in EHRs, using the ICD-9 diagnosis code set for example, will eventually make their way into EHRs, but it will take time and it still won't include people who don't interact with the healthcare system. Can you afford to wait? There's a solution possible today, and it's not rocket science. There's lots of social determinants-rich information already available and waiting to be utilized. The Census Bureau counts every person in the U.S. every 10 years. It also compiles lots of other useful information even more regularly, such as the American Community Survey, which provides comprehensive and robust social determinants information. It tracks demographic data such as age, gender, race, and ethnicity, but also data on housing, employment, education, income, access to transportation, and much more, the heart of social determinants. Data from the ACS is well organized and curated, conveniently available online, and absolutely free. And the Census Bureau even makes it convenient to identify and download exactly the data you need. The problem is, it's almost too much great information. What a problem to have. That's where the Social Deprivation Index comes in. An SDI is a formula that distills many social determinants of health factors into a single number, the index. It helps with comparisons and provides a convenient starting point for analysis. SDIs have been successfully used for population health management around the world, including in the UK and New Zealand. In New Zealand, the Ministry of Health uses a social deprivation index to determine resource allocation and explore health variation. A version of the Social Deprivation Index for the U.S. was developed by the Robert Graham Center in Washington, D.C. They started with social determinants data from the American Community Survey and applied data science techniques to determine which factors had the strongest relationship with health outcomes. The Graham Center SDI distills all the ACS factors down to the 7 that have the highest correlation with health outcomes, and then calculates the SDI score, which provides a starting point for identifying social determinants patterns in populations. So how do you use this data? Well, plotting social determinants on maps can give a sense for the social determinants patterns across regions. Clear patterns emerge quickly, but they can be misleading. Here's an example. In the Northeast, the overall social deprivation is fairly low. But if we shift our focus to the county level, we see more diversity in social deprivation levels. Even though Massachusetts and New York, for example, have a low overall level of social deprivation, there are pockets of high SDI. If we move further down to the zip code level, we see even clearer delineations of social deprivation patterns in eastern Massachusetts. In the Boston area, which has a low social deprivation at the county level, we can clearly identify zip codes with high deprivation. Summary level estimates are useful, but integrating social deprivation information with patient-level population data is even more powerful. Data from electronic health record systems or health information exchanges lay the foundation for that integration. Census Bureau geocoding services translate postal addresses to census geographies right down to the block level. EHR and HIE patient data provide measures of utilization such as hospitalizations, ED visits, and physician office visits, as well as disease burden, including risk profiles and comorbidities. Combining them gives you the best of both worlds in one place. Organizations can use this information to identify populations with the greatest needs and devise plans to help them. So now that you have robust social determinants enriched population data, what can you do with it? Well, here's an example. Let's look at diabetes incidence in eastern Massachusetts. Using zip code, we see pockets of high diabetes incidence scattered throughout the region. But they don't necessarily coincide with areas of high social deprivation. We could overlay social deprivation and diabetes incidence data to identify opportunities. To target areas for preventative interventions like nutrition counseling, exercise programs, and transportation to healthcare providers. In the city of Boston, we can clearly pick out neighborhoods with poor health outcomes and high social deprivation. Then we can create lists of specific individuals who would benefit most from those interventions, such as people with pre-diabetes. The quantitative data from these data sets can feed advanced analytics like machine learning algorithms to discover things that we might not stumble across on our own analysis, like which SDI factors are most highly correlated with health outcomes, and how those patterns differ across population segments. So, in summary, social determinants information represents a new frontier of opportunity for improving population health. Taking advantage of it is easier than you might have thought. The information is reliable, well organized, easily accessible, and in the case of the Census Bureau, absolutely free. With it, you gain visibility into opportunities to improve health and more confidently measure the impact of your efforts. Need help getting started? At Dimensional Insight, we help you keep the complex problems simple with our industry-leading Diver platform analytics technology. Everything you need in a single solution. We're the 7-time winner of the Best in Class for Business Intelligence and Analytics in Healthcare Award. We offer healthcare-specific applications that accelerate time to value by providing a head start getting meaningful data to the front lines of decision-making. And our healthcare domain expertise gives you the experience to guide you through to successful outcomes. We know healthcare and can help you innovate more quickly. Want to talk to one of our experts? Here's how to get in touch.